All right, let's try this again. I don't know what's going on. I can't figure out how to do these lives. There we go. Okay. So I was gonna go live again. If you guys have been here, this is on my YouTube channel. I think we're going TikTok also. So we're just doing a recap of the last semester of medical school for those of you guys who don't know me or you have been following my journey a little bit. I am a 41-year-old medical student. I'm at St. James School of Medicine. I've been a chiropractor for 15 years. I've been a naturopath for about 7 or 8 years. I've been in a lot of journals and magazines and things of that nature. And you guys have probably seen me from my other main YouTube channel where I crack celebrities and interview them. So last 3 semesters, I've been in medical school at St. James University. Pulled off a pretty solid semester. I managed to get 4 A's and 1 B this semester, so I came up short in a class called Behavioral Sciences. This still looks weird. I don't know what's going on with the filter. My eyes are all bug-eyed, and it says no filter, so I don't know what the deal is. So yeah, I wanted to talk a little bit about my strategies this semester that helped me to succeed for you guys that are going into these courses, or you're trying to make a decision on where you might want to go to medical school, or if you're interested at all. So for me, I definitely thought that I wouldn't like sketchy. Everybody swears by sketchy for microbiology. Right, boy, I appreciate it. But sketchy, man, it hit really hard. So I don't think I missed a single organism in my course this semester. So the only questions that I ended up missing were like bacterial genetics questions on like conjugation and transformation and things like that. And then virus genetics and yeah, they all seem to go pretty well. So definitely recommend sketchy if you guys are in medical school and you're studying microbiology. The only organism that they missed out on that we got tested on was an organism called Vibrio vulnificus. So I missed that one, and it basically, like if you see a buzzword of somebody walking in the Caribbean Ocean and they end up getting an infection in their leg or something like that, or a flesh-eating bacteria, think Vibrio vulnificus. So that was the only one that I couldn't find in sketchy. And then I definitely used Pathoma for Pathology 1, and I was able to get a 94 on that final exam. So that course is always a little bit tricky for me. So like anemias and leukemias and things like that, you'll have your CLLs and your AMLs and your ALLs, and you'll need to know the difference between the leukocytes and the myeloblastics. Those can always be a little bit tricky. So Pathoma definitely helped me with that one, but those are always tough for me. So obviously it's my second or third time taking a lot of these courses. My third time taking microbiology, third time taking biochemistry. They can be tricky for a lot of people. Obviously, I have an advantage having gone through chiropractic school previously. But yeah, they're definitely tricky. And med school questions, they're like tertiary or quaternary questions. I talked about this previously. The licensing exams, the USMLE step exams, in chiropractic school, the exam is meant to be like a baseline minimal competency exam. And that's that way for physical therapy and naturopathy and other things like that. In medical school, because medical students were competing for residencies, it turned out to be like the Hunger Games, where that score ended up being one of the deciding factors on what specialty you could go into, competitive programs and things of that nature. And so as a result of that, med students being smart as they are, they started competing, and the bar started going up and up and up. And it ended up being a way to divide these students and categorize them and stratify them. And when you're talking about U.S. med school students, we're talking about people that have an average GPA of 3.86, 512 on the MCAT. These are smart cookies, and they are going to find the resources to be able to score really well on these exams. And in order for them to keep stratifying them, the test writers for the NBME and the USMLE had to come up with much more complicated questions. So they end up being tertiary or quaternary questions, to where not only do you have to know everything about a specific organism, what diseases they cause, the pathophysiology of it, but you also need to know like a comparable disease and what organisms that would cause as well. Dale, I appreciate you. Thank you for the rose. I don't know what that means, but I appreciate it anyway. So overall, like the exams end up getting harder and harder and harder in med school, even though you're going over the same curriculum. Like microbiology is microbiology, anatomy is anatomy, biochemistry is biochemistry. But in order to test you, they've got to make much more complicated questions. They get very tricky, obviously. Josh says, what kind of beds to recommend for someone with lower back pain and pillows? It's super variable. I'm not exactly sure. You kind of have to try out different ones. I have one of those like super space foam ones. Works really well for me. It's been able to help my back pain a lot over the time. Definitely recommend not using pillows though if you have neck pain. a lot of times it'll push your head forward or to the side. Dell says wants to ask you a random question. Go ahead. What do you got? Yeah, so this semester I had epidemiology, microbiology, pathology 1, behavioral sciences, and CCBS. So, like I said, they managed to stick me with the B, so I've gotten 3 B's so far and 10 A's so far in medical school. So right now I'm number 1 in my class, been on the dean's list all 3 semesters. So it seems like my studying strategies have been working pretty well so far. The one thing I'll say, like at my age, like one of the most important things if you're studying, if you're going to grad school or med school, is going to be getting your life in order. And when I say that, I mean you have to be getting more than 6.5 hours of sleep every single night. Preferably more than 7, but you can't be giving up sleep trying to make up for it. My school has mandatory attendance, so I have to go to class from 8 to 5. And, I still have to find, time in my day to work on my health. So I try to get to the gym at least, I don't know, it's telling me to swipe something. Try to get to the gym at least 5 to 6 times a week, and I try to find at least 30 to 45 minutes to walk every single day. So you really can't excel in anything that's going to take cognitive abilities without making sure that you're getting your fitness in. If you can run, but for me, walking is the best one. I try to get at least 45 minutes a day. That's been able to help me keep my blood pressure down, which is super important because you're obviously stressed when you're in medical school. And then, like I said, get to the gym, move your body, lift weights, do resistance exercises, especially at my age. I'm 41 now. I'm hitting an age group where I'm going to start seeing sarcopenia and osteopenia, so it's very important for me to load my body, but also to do it in a way to where I don't get hurt. So in Anguilla, I was able to find a couple gyms, not air conditioned, so you get really sweaty, but able to get good workouts in. So that helped me a lot. I think as far as like performing in class. So really I've been able to excel so far. So we have the NBME exams. They're kind of our shelf exams, and they compare you to U.S. med school students. So I've been able to score between 10 and 20 points higher than the average U.S. med school student on every single one of my NBME exams so far. So my study strategy seems to be working. So what I really try to do is I lock in. I have to be in class. And I at my age, I've learned my lesson. So when I was younger, when I was in chiro school, I wouldn't pay attention in class. And that was basically, killing me as far as like having to make up for it on the other end. Hey, look, we got DC to MD. I'm going to invite him on here. So, making sure that I have that 8-9 hours a day. I'm going to be locked in class. I'm going to be paying attention as best as I can. That varies from class to class. Sometimes you have classes that like have accents that are very difficult to understand. So you have to sort of figure that out. This semester I was really lucky. I could understand all of my professors pretty well. So you don't want to waste that 8 hours and end up having to go back and relearn those things again. So doing that allowed me to kind of lock in on the things that I didn't understand. So if I was in class and there was a topic that I knew I needed to review more, I would save that and I would go onto YouTube later and watch that video. So whether it's Dirty Medicine or Medicosis Perfectionalis, just to make sure I don't fall behind. And I basically would only study when I had a quiz or an exam. Like I said, that could get really hairy a few times per semester. So for this MD3 semester, we ended up having like 5 quizzes in a row in 3 days the week before midterms, and then we had 4 midterms in 5 days there. So that ended up getting kind of hairy. So I would have to study beforehand. So that would usually mean that I would have to study 15 to 20 days in a row, typically 5 to 6 hours. The only good thing about the final exam is you usually don't have lectures those days, so you have that entire day to study. So that definitely helped a lot. Dr. Chet PT says, did you get your prereqs done? If so, how long did this take? So the thing about, my undergrad degrees are in biology, anatomy. So the prereqs are pretty much all the same for PT school or chiro school or med school. My issue at my age is that I finished all those courses a long time ago. I graduated undergrad in 2007. So a lot of the U.S. med schools, they won't accept the credits if they're within 7 years. Where the Caribbean schools, a lot of them will accept. They're a little more lenient on your prereqs. So they were able to accept those courses that I had taken previously. But I have to say there has been some stuff that has changed, particularly when it comes to like microbiology and genetics from when I graduated undergrad, which is 18 years ago, which makes sense, So I've had to catch up. Even physiology, there's some things that are a little different. I was like, I don't remember this from previous. but by and large, I've caught up. Like I said, I'm doing pretty solid. And hey, look who we got here.
What's up, man?
We got everybody's favorite. If you guys are not following DC to MD, make sure to go follow him. He's trying to one up me in the age category of chiropractors that are
Oh,
in medical
I'm
school.
not trying. I'm achieving that. No
He's
problem.
achieving that. So he's our 54-year-old chiropractor, doing well in medical school.
Yeah, 55. Just turned 55.
55. There you
Yeah,
go. He
yeah,
gets the discount at the home country buffet now.
yeah. I can we qualify for the 55 and up retirement communities here in Florida now.
There you go. Italics, man, keep watching the YouTube videos, brother. I appreciate you guys watching. Are you in St. Vincent or are you in Florida right
No,
now?
I have a flight tomorrow morning.
Okay, so you're back in Florida.
Back in Florida. Yeah, it was a quick break, just 2 weeks and shy of 2 weeks.
Yeah. So we were just talking strategy. So tell us some of your strategies of how you've been able to be successful in med school so far, having been out of school for a long time.
I think it was the fact that always had that thirst for knowledge. I don't think I had any lapse in always learning more information. And I think that was a key because if you're coming in cold, I mean, I know you do your CEUs if you're a nurse practitioner or chiropractor, and usually they're rules, laws, medical errors, ethics. But then you get an extra 20 or so, and mine were always in nutrition and functional medicine stuff. So I think that played a big part in it in terms of making sure that you were continuing to sharpen the blade, if you will, right? I think that played a
Yeah.
big part of it for sure.
Yeah, for me, like even though I didn't have that long of a break, I think I got my second doctorate in 2017, and I started med school in 2022. The type of studying was just a lot different. I could cruise my way through a lot of stuff, but I got punched in the face in the first semester, like right off the bat. I kind of had forgotten how to study, I think there's a lot of things that go on. I think your brain gets in shape. I think actually your eyes get in shape too. Like your ocular muscles are allow you to focus in on it. And I was really struggling to study. And that first histology quiz punched me right in the face. And then I was like, man, maybe I don't have this. Maybe I have CTE. Maybe my brain is degenerating. Maybe I was just too dumb to go to med school in the first place. And you might have had a similar experience, but luckily I didn't quit. And so far we're doing pretty well. Doc here is going into his fifth semester. So he's going to be in dedicated studying for the NBME CBSE, which is basically the prereq for the USMLE Step 1. At our school, you have to get a 64 raw score to be able to sit per step. And the school does that to make sure that everybody's prepared and that they're going to be passing because, we're coming from an offshore school. It's already sort of a yellow flag, but one thing we can't have is a fail on our step. And so the school sort of creates these barriers to make sure that we can pass them. And so he's finished all of his basic science coursework as far as new coursework. So now he's going to be reviewing all that stuff, and he's going to take I think they have a diagnostic exam first, and they take the CBSE at the end of the semester.
Yeah, well, I'll say the first midterm for histology was a bit of a wake up call for me because we had two quizzes before the midterm, and this is MD1, and I did well on them. But then the midterm was okay. I studied every lecture note, and I don't remember seeing any of this information on there. And that's where halfway through the test, Bo, I kind of started to hit the rails as if I was on full tilt if I was playing poker. And there's 125 questions, and I got to about 62, and you know how you just can't get on a roll.
Yeah.
And so I just go like, forward, 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 forward. I was like, oh, I don't know if I want to be a doctor anymore, And then, and then I was like, okay, Joel, you're going to get to question one, and you're just going to retool. And sure enough, when you're able to flag the questions that you just didn't answer or you thought were a little tougher, and sure enough, you just compose yourself and you're like, oh, I know this question, I know this answer. So it's a lot of it is like you said in terms of just mind control and just overcoming and adapting and understanding how to study smarter, what is actually important, what's not important, because there's only so much time on the clock each day that you can, and it's like the mail, like I always say, there's never a recession in mail, right? There's
Right.
always, you're never going to catch up.
Yeah.
So but yeah, MD5 is this review. I'm excited for that.
Yeah, yeah.
Now,
At least it's not a bunch of new stuff. You're like, let me just see how much I can lock into stuff I've already seen. You
right,
know, so that'll be
exactly.
good, and
Yeah,
it'll just be like sharpening the blade a little bit. Yeah,
yeah.
and MD1, for us anatomy wasn't so bad, for me at least, and probably for
You
you as
guys have
well.
the cadavers on that on there or no?
No, we had the
Yeah, the
anatomatage.
table, the
hmm
anatotage. Yeah.
But like chiropractors get a lot of anatomy education. I think I had 4 courses, and I had systemic, gross one, gross two, radiological. So that
What
didn't
what
require.
chiropractic college did you go to?
I went to Parker.
Right. And I mean, I would say that was for sure is a lot of people ask me what the bigger difference is. And for sure, for chiropractic college, the anatomy hands-on is not
Yeah,
even close,
yeah,
you
yeah.
know,
And
how much
so
more.
that didn't require a lot of effort to get an A for me in that class, especially like the MSK portion. And when I started, we were still in the block system back then. So we had 4 exams, and each of the exams was curved, and the quizzes were like CCBS quizzes. So it was a pretty easy run to an A for MD1. Histology, like I said, I got a 36 on my first quiz, kicked me right in the teeth. So I had to scramble the whole rest of the semester to get back to a B to make sure I didn't end up with a C in that class. And then the research class was a cakewalk. The CCBS class was a cakewalk. So I think you're a little inundated. I explained to these guys earlier that like the type of questions are tertiary and quaternary type questions, and I think that became I said as it became a result as for chiropractic, the board, and for PT and others, that's a minimum qualifying exam. Like you're not competing. And in med school, these scores ended up being ways for people to stratify themselves for residencies. So now we ended up coming up with a way to differentiate these top-notch 3.9 students from each other. And the only way to do that is come up with the craziest possible questions that you ever could get into as far as minutia. And I think that's how the NBME ended up where it is and why those questions are so much more difficult than the chiropractic board exam questions. So where it's like they tell you everything you know about a bacteria, and you're like, oh, sweet, I got this. And then they'll say, which of the following is a similar mechanism to this? And so now you need to know everything about some other bacteria that wasn't even related to that question. And those are the kind of questions that you get on these NDME exams. Where a chiropractic exam, they'll just say, hey, what nerve innervates this muscle? And you're like, well, that's pretty straightforward.
For sure.
Um,
That's very true.
or
Also,
even like
too,
micro, it'll be like, a target or whatever. And you're like, oh, Lyme disease, got it, boom.
lots of experiments. You're an experimenter. You're conducting research on this, that, and the other. So it's not it's just using the foundations to come up with some crazy scenario that you have to. I find that even now you'll see that they do less and less information. It's very vague, and you just have to use the info. But one thing I do like, and maybe you've probably noticed this too, is there'll be a question where you're not quite sure on, but 40 questions down the road, they have that other piece of the puzzle.
Yep.
And then you have to go back and find that other one that like, oh, I can answer that other one now
Yep.
because they give it. I
100%.
and I think the reason I'm not, I think the reason they do that is because that's part of being, I think, a doctor and being in a triage and having to kind of use your senses to orientate yourself, even though you might be overwhelmed, to use the pieces of information. So in that way, you're right. Chiropractic is more first order, like what's this, what's that, what's this, what's that.
Yeah.
But this is more 3, 4, 5 levels deep.
Right. And yeah, for me, so like MD2 was kind of a kick in the teeth because instead of just having one hard class for me, which was histology, now you got 3 that are really going in depth. You have neuroscience, you have biochemistry, and then you have physiology. And they say that every semester it's like a new kick in the teeth. And then so you have those 3 hard classes in MD2. You have to learn how to study for that. MD3, now all of a sudden you have 5 courses. So now they're beating with volume. Like the courses may not be harder per se, but you just never have a break to study. Like my MD2 schedule for finals, we were complaining that we had 1 day between 2 of the finals. Oh, we only get 1 day between the 2, and then you get to MD3 and you have 4 finals in 5 days.
Right. Yeah. I felt MD1 to MD2 was a bigger like water pressure jack up the PSI than MD2 to MD3 was, but MD2 to MD3 was a longer climb to the summit versus
Yeah.
the first term. And I think it was smart in the sense that MD1 is boot camp, is sort of like summer camp.
Yeah.
right? And then MD2 is boot camp.
Yeah. It's like getting you ready, like, all right, here you go. Like this is, but it felt like a lot, honestly. Like MD1 felt like a lot. It was like,
It
dang,
did.
this is kind of hard.
Right. It's that learning curve. It's just so much information. And
Yes.
histology, like that would be, if you haven't been back to your question, like preparing or how to, study, that would be one of the ones, even if you did keep up with your continuing education credits, that's
Hmm.
cell biology 101, right? And
Yeah.
that's like I find that some of my classmates that not only they are older, but they didn't have a really strong science background,
Yeah.
that's where the mirror and the image in the mirror reflects back on you like, oh boy, I don't know this stuff. And it's only going to continue when you get into MD2 and MD3 as that cell biology builds on it. And that's where, so, some people I was TAing, Beau, I don't think I told you this, I was TAing some people, and I remember shaking my head thinking like, if you like, I'm trying to teach you something, and if you don't know this, like you're in trouble. Like you've and sometimes I think people aren't realistic with their expectations,
Yeah,
and
for
they
sure.
really need to look in the mirror and say like, okay, maybe I'm in over my head. I think the cell biology is a good barometer for you to know like, okay, if I can get through this and I understand it, then I'm not in over my head on
Yeah.
this.
Yeah. And one of the things we take, like we take these MBA exams at the end of the semester. So like, even though I really struggled to get an A on any of the tests in that course for which is a little strange for me, but
For
and I put a lot.
histology, well, that was histology you're
Histology. I
talking.
put a
Yeah,
lot of
yeah.
effort into it, but when I got my MBME score, like it's weighted against the average U.S. medical student. So I was like maybe 5 points above the national U.S. medical school average. So at that point, that made me realize like, okay, I can do this.
Right, right.
Um, it's maybe not the score I wanted, but it also tells me these U.S. med school students have 3.9 GPAs and 512 MCATs. If the average is 69 there, then we're not too far off if you're getting 74, 75. And we're in good shape. It may not be, like I said, the score we wanted, but we're where we need to be. And just again, learning how to study, learning how to be efficient, learning this new technology. For you and I, we didn't have all this, internet stuff back when we were in school.
Internet stuff.
Yeah, this
Yeah.
internet stuff. Like for my Cairo school, we would get these like booklets, and they had all the lecture slides for the entire semester in them. So they would test you off of that, but it wasn't something you could carry around with you like a phone. You couldn't project it. You couldn't do practice questions or things like that. That kind of stuff didn't exist back in the day. And so like finding these new resources and trusting that like people that have been through this probably have the right ideas. You just have to see if it fits for you. That was tricky for me. So I still don't know how to use Anki like really, but I've at least figured out how to use it as a basic. So like one of my study strategies is to go through the lecture notes. I look at a slide. I think about how I could differentiate what's on this slide from another one, and I'll ask myself a question, and I'll use like voice to text, and I'll make my own Anki cards out of that. So for every quiz, I make about 400 or 500 of my own Anki cards, and then I try to get through them 3 or 4 times. That's how I had only studied up until MD3, and then I started listening to other people and using Pathoma and Sketchy for microbiology and for Path. And boy, I was super skeptical. No way this is going to work. These are dumb cartoons. Man, that game changer for me. Like I'm like, oh, I'm a sketchy guy. Apparently,
I
I'm
hate
watching cartoons
sketchy.
as a
I don't know.
41-year-old.
It gets once it gets past 8 to 10 minutes, it's just okay. There's too many things to remember here on this cartoon. But I've been told that in terms of sketchy for a couple guys that did very well on the NBME that just recently passed. They did sketchy for farm and sketchy for micro because
Yeah,
there's
those
just
two.
too much, right?
Yep. And that's what I didn't. I was saying earlier. I didn't miss a single organism in microbiology and immunology, and that's strictly from sketchy. I did miss one. I missed Vibrio vulnificus because it's not in the sketchy. So if
Right.
you're in the Caribbean and you're walking and you have a necrotizing fasciitis, that's Vibrio vulnificus. I'll never forget it again.
There you go.
But they only do Vibrio cholera in the sketchies.
Mm.
So they didn't have any immunology. So I did miss a few questions on like B and T cell maturation and thymic maturation and some of the CD markers. for whatever reason, I still have a block when it comes to lymphocytes and leukocytes. So when I'm talking IL-3, IL-2, IL-7, I still get those sort of mixed up. And then the genetics portion, like conjugation and transformation, those are really the only things I missed because none of that stuff was in Sketchy.
Right.
You know, but all in all, like super solid. And same with Pathoma. Like Pathoma, like really locked in.
I'll tell you, I had a mini panic attack because so I was doing Pathoma very like watching it through and then watching it through, doing the notes and then watching it through a third time. And he's fantastic.
Yeah.
But then I went and did UWorld questions after doing Pathoma. I was like, okay, where did all those 17 hours go that I just finished watching Pathoma for? I was like, oh my goodness.
Yeah.
But the average was very, like, so the NBME average for Pathoma Path 2 was 58. And I thought excuse the language, I thought I shit the bed on that one for sure. It's like, oh my God, that was a lot harder and it turns out I got 73 on that one. So
Right.
that was and I was like, it's only because, well, not only because, but Pathoma allowed you to kind of think on your feet as well. Right.
Sure.
So Pathoma's I guess, how do you, do you purchase all the sketchies and the Pathomas, or do you have sort of a rogue site that you go to get
I don't. I
those?
pull them out of the Mega Drive, generally speaking.
Oh, right. What's it called? What do they call is the Mega Drive called something?
The student drive or whatever, where people have kind of.
Yeah, the bundle
I probably
hit or
shouldn't be saying
something,
this live. We're not pirating stuff.
No, I don't know what you mean by that. Yeah. There's like a student portal thing that they have a
Yeah.
bunch of, okay, that's where you got them from.
This was given by other students.
Yeah, but I think Sketchy kind of put a glitch in there where you can't access their stuff.
Oh, maybe. I don't know. I was able to download for micro, and I mean, I would obviously pay for it again. I don't have any problem with that. But and then for epidemiology, that one was a little tricky. So I did use Amboss questions for that, just because there's just a lot of different ways for them to write those questions, and you've got to use your 2x2 tables, and then like it's a time crunch. You have a minute 30 per question.
The time is definitely a factor for sure.
And I swear to God, the questions on there are the longest paragraphs compared to any other like. Like, why do I need two paragraphs?
The behavior one, you were tired. You ran a marathon after that exam.
Yeah.
It was, the what do they call it? Vignettes were like
Yeah.
8 to 10 sentences long.
And you only have a minute 30, so now you're panicking, trying to like skip stuff to find the important information in there, and then you miss it, and then you have to start going all over again. And then like not being able to use a calculator, you have to use the calculator on the screen, That's brutal too. I will say this for our exam, at least like if you knew what you were looking for, like you could eliminate the other answers for the most part.
Right.
They weren't moving them like 1 decimal point over or things that you could really get confused on. That was the only saving grace. And then because a lot of the calculations are lengthy, at least there were like a bunch of questions on like is it above the curve or below the curve or things like that, which are they're quick questions if you know what you're looking for.
Yeah, for sure. I know for the midterm, for the MD3s that were behind us, one of the guys asked me, "What do you remember being on there?" And I told him, "Oh yeah, make sure the median and then 2 standard deviations and how to figure that out." And he said they never really learned very much of that, and there was probably about 15 questions. I was so grateful that I told him about that because
that's crucial. They're really easy if you know it. Those are gimme questions. But if you don't, man, that's a lot of questions to throw away.
It sucks. Fortunately, I haven't had too many of those where there's too many questions that if you don't know, you get screwed on.
Yeah, that was one of the things with behavior that killed me is like the subjectivity of them, and then like in the psychology stuff, like the id, ego, superego, and you can't reason your way through it because you're trying to decide, is this the reasonable part of the person or is this the devil on the shoulder that's putting into his head?
Right. Sometimes though the behavior ones, they kind of make you laugh out loud with some of the ridiculous ones. Like, what would you say to the patient? Like, oh no, you can't do that, or just some of the ridiculous option choices that they give you for the ethics ones.
Well, in the ethics ones, like you'll find a lot of different answers in different resources too, so you end up getting confused. And that's like one of the worst things you can do with limited time is to get different answers from different places. because in your mind you like eliminated that one, but when you go to bring it back in, you can't remember if it was because you eliminated it. You know,
Right.
the tip of the tongue phenomenon that kind of gets you through a test. You're like, this sounds familiar.
Yeah,
Um,
right. Usually, though, there's the with the ethics, it's usually either you ask an open-ended question and you want tell me more about that or whatever, like
yeah,
kind of thing. But
we had one where like we were talking about it, and it was like, yeah, well, the woman gets the choice no matter what. And then we had a question that looked like the parents come in and they're doing a test, and during the test they find out that the father isn't the father. What do you do? And then I got tricked by saying, inform the mother, but don't document it. And like, you're not supposed to do anything because that wasn't
right,
why they were coming in.
right. It's funny. A couple of questions that I usually get on the holistic ones is I get them wrong because I think as a chiropractor, it's not gonna be the holistic answer,
Right.
and sure enough, it is. And
Yeah,
I
yeah.
kind of, and that when you get to, I don't know if this has happened to you where you get to look and see which percentage of the questions that everyone got right, like
Yes.
90%, and it always chaps me when I see like I got it wrong and 90% of them got it right. But
Yeah.
then, usually I'll get one that like 35% of them got wrong, or 35% get right. I usually get the tougher ones.
Yeah. So I'm gonna kind of go over to
Yeah,
the
I'm gonna
audience
jump
like
off. I'm gonna
my
jump
my
off.
study strategy, and then I want you to like kind of tell them your study
Okay.
strategy.
All right.
Everybody's different.
Yeah.
So for me, I only study typically 2 to 3 days out for a quiz or for an exam. And what I really try to do is lock in during class and pay attention the entire time, not miss anything. Just like lock in, try to absorb as much as I can. That way, it saves me time. That way, I have time to eat healthy, to walk, to exercise, and all those kind of things. MD3 got tricky because we end up with 4 or 5 in a row, so you run out of days to study on that. And that was sort of my getting in between, because in Cairo school I wouldn't pay attention in class, and then I'd have to spend my time after that relearning or learning it in the first time, and I would oftentimes end up pulling all nighters or half all nighters in Cairo school, which super detrimental to your health, not good for long term accumulation of knowledge, and obviously I could get through it, but I've really tried to balance out my studying, and like for me I'll never stay up past 11:30 studying, even if I didn't get through everything, because for me personally the sleep is more important. I'll be able to access more stuff and work my way, at least I'll be able to logic my way through questions if I'm fresh than feeling like worn out. Some people would rather see it a few more times. Where do you kind of fall on that?
So it's the same thing. Like I pretty much hit a limit unless I've just been on an IV of caffeine the whole day. At about 12 is the latest that I usually go. And usually about 11, I'm usually down. And then I could get up at around, if it's a test or a midterm, I'll get up at 4. So I'll get a good 5 hours. But I think what you said is so key in terms of really paying attention in class. Because I never miss class. And I don't get the people that miss class to study the stuff that they missed. Like
Same.
it doesn't make sense. Like you're falling further behind. And
Yep.
I can kind of understand the concept of it is overwhelming to have topics that you don't understand, that you're behind on, and have new information. But just like you said, just separate your emotions, take one or two things out of it, if not as much as you possibly can. So you just saved yourself that amount of time
Yeah.
for studying. That's key for sure. And
And
then
treat it
find
like a job, right? Like it's an 8 to 5. Like go in there and
Yeah,
take it seriously.
and really be focused. And sometimes, like you have the Ferris Bueller effect, where you can't, you just the teacher may not be the greatest, but you still have to. And there's a difference too. There's a difference between studying for the quizzes in school versus studying for midterms,
Right.
right? So, but find the resource that you like. And I think for me, I've erred on, if I'm guilty of something, it's learning too much of the foundations and the knowledge and not doing enough questions,
Yeah.
right? And I
I, I
think
don't
you,
I don't really do any questions. The only time I've ever done questions is for Amboss. So this is like an interesting like pattern too. So my buddy Robbie, really genius guy, he had like an 89 on the anatomy, NBME. His philosophy, because he's looking at long term goal, right? He wants to pass step, and so he's constantly using third party resources and not using the stuff from school to get him ready for NBME and for step. I've sort of nerfed the opposite direction. I'm taking each semester at a time and just trying to get the best grades that I possibly can based on whatever information that teacher's teaching us. And sometimes that's, they're not teaching us the stuff that we need for the MBME, or they may be too focused on minutia that isn't relevant. And, I may end up getting caught up later on because I'm more focused on the current thing, the grade, how to score well in that class as opposed to the overall. Where do you tend to strategize or go towards that?
Yeah, I mean, I don't do, like you said, if I'm guilty of something, it's not doing enough questions. So the foundation is the foundation, whether it's a different foundation for class or it's a foundation like your friend Robbie does for getting prepared for the step or for the MBME. So I really like to understand the concept, right? And then, but I do find that those questions, because they're my buddy who he's 94 raw, it's crazy, and I will say, just switching up the information a little bit, he reverse engineers through ChatGPT. So
Oh, interesting.
he will first condition ChatGPT to say, okay, I want you to act like you're a PhD professor of microbiology, this, that, and the other. And I'm trying to find ways to shortcut my study time for the most highest yield questions that appear on MBME, help me come up with the whatever he does. And then he'll ask chat, and he pays for the extra version. He'll say, how confident are you on passing the MBME / step? And it ends up being like 97% confident that I can pass. So then he ends up getting pretty much all the questions that would ever kind of come up on this particular topic, and then really shortcutting his study time. Or he'll even, with Pathoma, the notes for Pathoma, he'll upload that to ChatGPT and then get chat. So I think that AI can really shortcut your, and it took us till MD4 to kind of realize that, right?
Do you use it too?
I kind of piggyback off of him. And
Okay.
he's nice, but he's not like, I'm going to share you 100% everything that I got kind of thing.
Right.
So I've kind of learned how to do it that way as well. So
Interesting.
yeah, for sure.
Yeah, like for me, like a lot of times, like depending on the class, like epidemiology, for example, I did do AMBOSS questions, but primarily I was just raw dogging slides because I knew that she was making the questions for our final
Right.
exam.
Right.
So it's going to come from her material. So, if I have time, I'm going to go make all my Anki cards. But like this semester, I didn't really have time towards the end with all these exams. So I was really just, I don't like to rewrite anymore. I find that to be not the most efficient. That definitely is something I used to do.
Yeah.
But I was just, reading those slides over and over and over again. And it just depends on the course. For like behavior, it was cumulative over everything. And I started counting, and it was 45 lectures, each with about 90 slides. Like you cannot,
Crazy. Can't do
you're not
it.
going to be able to get through that in a
No
few
way.
days.
No way.
For epidemiology, it was 8 lectures with about 75 slides average. So I was able to get through that a bunch of times.
You could even upload those slides though, and then get you to ask you like the most high yield, like cross-reference it with NBME topics and
Yeah.
first aid topics, and it will really shortcut your time for sure.
Yeah. So that's what I've been able that's been my strategy to get good grades so far. Will that pay off on comp or step? I guess we'll find out. But that's been able to like land me, I've had 10 A's and 3 B's so far
You've been doing
at St.
awesome. I've
James.
seen your transcripts.
So, but my focus is primarily predicated on a grade in the class. And it's sort of irrelevant because like residency programs, not only do they not really care about your basic science grades, but I'm not even sure they look. So, it's really just more for maybe vanity or something like that. But I don't have another strategy necessarily to, being 41, not really knowing anybody who's been through med school recently. I'm just kind of raw dogging it and trying to figure out I figure if I get 94s in the classes, I should be able to pull a 64 on a comp exam, but I could be wrong when it comes to that as well.
No, it doesn't. You don't get those scores by accident. Like you still have
Yeah.
to You have to know those. One thing I got just ready for, which I haven't used completely, but one of my friends that scored 75 on the MBME just went by, he did a lot of boards and beyond. So
Yeah.
that's one thing that I'm going to be focusing on going into this term. And I hate to say it, he would sit at the front for every single lecture up until MD5. And then
Uh-huh.
MD5, he would sit on the back with his big headphones on and just do his own work the whole time.
Interesting. So
Yeah.
I know a lot of people, like on the Anguilla campus, med school boot camp was really popular. Like a lot of people were just all in on med school boot camp. They preferred that to the lectures. I guess it depends on, for me, it's the accent level of the professors. I had a couple in MD1 that I really had a hard time understanding. So for those folks, I could definitely understand wanting to watch a third party resource. I was really lucky in MD3. I could understand all my professors like really well. And I guess it just varies by semester, like how people do that. So the thing about US med school students is, a lot of them, hey, we have a 41-year-old in Jamaica that's in med school. Congratulations. Um, in the US, a lot of them, most of the schools don't have mandatory attendance. A lot of them are pass fail for their preclinicals as well. But the thing is like we said earlier, the average MD student has a 3.86 undergrad and a 512 MCAT. They're not worried about them having the discipline to get done what needs to get done. So that really allows them to shorten their day. If they could study 5 hours of an 8 hour lecture, they're going to be able to have a lot more time in their day. With our school, with the MCAT potentially being passed over and with students not having to have a 3.8, there are going to be students in here that they may lack discipline, they may be young, and so by forcing the mandatory attendance, you force them to be there, but also that eats up 8 hours of their day, and not everybody can pay attention. So it really makes things longer for some people.
I know you sit on the student board, right? I think you are
Yeah,
on the for so I had this conversation too. I'm for mandatory attendance. Just because I mean I get and my friend he's not, and I could see the point of if it's not a good professor, and sometimes like our micro professor is a savant when it comes to microbiology, right? But if in her defense, the it's probably the hardest course in med school, right?
yeah,
But if a sports team constantly performed below 500, right, and they weren't having a winning record,
yeah.
you wouldn't keep blaming the players at some level, right? I mean, there is a real skill set to teaching,
Yes, absolutely.
and if you're not getting anything out of it, and you can maximize your time. I see the argument
Yeah, yeah,
of making it not mandatory, but I think that I'm for it in the sense that go show up to class, even if they're not the best professor, you still can get something out of it, and they're going to tell you what's going to be important for the test. That
yeah.
when you go and do it on your own, you're going to. So it's one of those. I could see arguments for and against not showing at all.
Yeah, I mean, I didn't miss a single class this semester. I did skip one or two in MD2 where just like where the tests lined up on a certain day. I just needed the time to be able to study. But then you end up robbing Peter to pay Paul, and then you end up behind in that course. And somewhere around our schedules got all knocked off last semester with the school opening and everything like that. So we ended up having quiz two, or was it quiz three? We
It
were
was like
going over
quiz
quiz
three. It
three.
was like right after.
We were going over quiz three material before the midterms. Um, and we were like, well, how can I be studying for the quiz after the midterms when none of this material is on the midterms? So you end up blacking out the quiz three material because you're getting ready for midterms. And then right after midterms, you have these quizzes, but you weren't paying attention in class. And that's something that got me last semester. Where this semester, where the midterm was more where it was supposed to be, we didn't have that kind of happen. Um, that was kind of, and it just happens sometimes, I guess, right? Like nobody knew that the campus was going to close in Anguilla. Nobody knew that they were going to off shift the midterms. I mean, it's life. Things happen. You have to be able to adapt, and that's part of building grit. is being able to rise up to a challenge. You get your butt kicked on a midterm or a quiz to bounce back and say, this doesn't define me. I just know I need to put more effort into this, and then winning, right? Like,
For sure. And I think it is a mental jujitsu game when you're eliminating answers. I think if you're, like you said, if you go back to your study methodology and you're understanding the concepts, even if you see a question that you're like, oh crap, I don't even know what they're talking about, you
yeah,
could eliminate one or two answers just because you know it's not the ballpark.
right.
And you can pretty much nail it down to two, maybe three answers. And then, like I said, if you play the patient game and you come up to, question 62 after that question at 22, and they
Yeah.
give you another piece of the puzzle, you go back so it really is a mental, you got to keep your emotions in check for
And
sure.
it's a skill set too that you can, like for me, it definitely has gotten better with like consecutive semesters, like my test taking skills, endurance,
Right.
um, being able to problem solve. That was definitely lacking in
Answer
MD1 for
them
me.
quicker. Do you find like answering them
Yeah.
quicker and not
Yeah.
thinking
Yeah.
about it kind of thing?
Even with our old brains, we don't have the 22-year-old,
Right. Well, I don't know
brains.
about you, maybe me.
We have Dr. Ali Alahi in here. If you guys have seen him, he's got 1.5 million followers on here. He's the Dallas Ring Dinger chiropractor. What's going on? He asked us why we're going to med school.
You first.
Me first. Oh boy, that's a good question. Oof. A lot of reasons and a lot of silly reasons probably too. I think I've always wanted a third doctorate. Um, I played college football. I was a linebacker, so I definitely have concerns over CTE. And one thing, I tried out MD1. Just it was during COVID. I just kind of was curious. I got into the school. It was the only one I applied to. COVID sort of incentivized me to want to look into this also. And then I had done some stem cells at the time as a patient, and I thought that might be something I was interested in. And what I found is that going through MD1, my brain was much sharper. I felt better in every aspect of my life, to be honest. And I had been out of academia for about 5 years. I used to teach doctoral students, but I haven't been. I've just been doing YouTube and running my businesses. But I think my brain had been less sharp over that time, and I like the way that felt. And I do have a fear of CTE, and I do think that people not testing their brain and keeping it sharp is a big component of why that happens. So that's a big part of it for me. Finishing what I started is a big part of it for me. I'm also very interested in doing regenerative medicine in particular, particularly PRP, stem cells, ozone therapy, all that kind of stuff is something I'm definitely interested in. And then, when I've been in school, like neurology does interest me, even though I think that residency would be a grind. I'm not sure that I want to do that at my age and my financial situation. It is something that interests me. So that's probably my reason. And I think Doc will probably say this too, is, at some point we're also going to have to show, like, we're going to show people, like, we're tired of people saying you can't do this. You're not smart enough for this. I can't lie and say that isn't a component of my decision making to prove that I can do this, and do it well and pass this course. And, when I advocate for conservative therapies in the future, whether it's chiropractic or acupuncture or whatever, and they go, you're not a real doctor. Well, my MD will say otherwise.
Yeah, for sure. Those are all good reasons. I didn't know that about the CTEs, but for sure. So my wife wanted me to do it 20 years ago. And so it took me 20 years to finally listen to her. I'm from a traditional medical based family. So I was the rogue, holistic alternative doctor. I hurt my back and I didn't want to go undergo surgery. And it was an epiphany when a chiropractor adjusted me, like, okay, that's what I want to do. Finally know what I wanted to do. And I had to actually go back to school because I already had a undergraduate in exercise physiology. I was a personal trainer, and the school in Canada was really hard to get into. It was only 150 spots, and the province I
Oh, you're
went
from
to,
Canada?
yeah, I'm from Toronto,
Okay. That's why
and
he's doing so well in school.
yeah, there you go. And so 150 spots, 75 of them from Ontario, but in Ontario you probably get about 3 or 4,000, 5,000 people that apply to it,
And it's a
right? So
CMCC.
CMCC, yeah, and it was 5 minutes from where I lived in Toronto. So My undergraduate, my first 2 years, I was going to class was an elective. Let's put it that way. Like I played for the varsity soccer team and I just did enough to get by. And that ended up biting me in the butt when I applied to chiropractic college because my last 2 years were pretty good, but my first 2 years were like just enough to get by.
Yeah.
So I ended up going back to school part-time to get a second degree in psychology. And I made Dean's honor roll. But when I applied a second time to get into chiropractic college in Canada, it didn't change my GPA because the small print said a full-time study, which I didn't read the small print. So anyways, long story short, I ended up going to school in chiropractic college in California and I loved it for 10, 15 years.
Yeah.
But then it just, I got into fatigue, exhaustion, burnout, hormones, even genomics, genetic stuff. And I knew as a chiropractor, there's no way I could do that. And my kids, I have twins, they were older now. And when I found out that St. James didn't require to do the MCAT, that for some reason for me was like an albatross I couldn't get over. It's like, no, I can't do an MCAT. I can't. So then once I found out that they didn't, it was just like from basically July. I almost started in September instead of January. And I think for me, having a bigger impact, stem cells, doing anti-aging, especially in Boca Raton. I mean, and just as a chiropractor, as much as knowledge and information as I have, whether it's people don't take you serious or businesses, or I just felt that there was a ceiling. And, if I would have listened to my wife 20 years earlier, I would have probably done it 20 years earlier. So,
Yeah. Yeah, we have an office in Delray Beach actually, so we're not too far from you.
Oh, cool. Where is that at? Where in Delray?
Pro Tennis World. It's right off 95, I think.
Yeah, no, I know where it is. There's a nice big stadium there, right off of Atlantic.
Yeah. Yeah. So for me, like I similar to you, like I used a chiropractor in high school football. Growing up watching like the 49ers and the Cowboys and all these guys, they would all talk about their chiropractor. And it definitely helped me during high school. So I never really went to the doctor when I was growing up. I never went to PT. That was kind of my only real experience other than an optometrist with the healthcare system. Played college football. I was always into biology. It was always interesting to me. So I majored in biology. Nobody slapped me in the head and said, that's a dumb degree. It doesn't lead anywhere. So when I got done, it was like, what are you going to do? You're not going to be a biologist unless you do a PhD. And then even they only make like 70 grand a year. So I started, looking around and I was like, well, I don't really feel like doing medical school and a residency. I didn't know anything about PT, but my chiropractor has a pretty cool life. Like, he obviously does fairly well. His hours are awesome. He plays golf all the time. Like I went to a nice school and his daughter went to school with me. So he obviously did financially like pretty well. And that just seemed like a cool life. It would give me time to lift weights and, be able to help athletes and things like that. So then I ended up going. And then when I got to chiro school, I was a little bit taken aback by, Parker's a mixer school, but there's definitely a philosophical component to it that was very foreign to me being a hard science person. Very, very rigid in certain techniques. And they just didn't make a lot of sense to me. Like I know manual therapy works and I know diversified gets joints moving, but the deep philosophical parts of chiropractic never resonated with me. I didn't understand it. It felt very religion-y. And probably my fourth semester, I was actually considering transferring out and going to Texas College of Osteopathic Medicine. But I kind of looked at the timeline. I only had a couple, like 4 more semesters left. And say I made 110 grand a year as a chiropractor over X amount of years, I would have to drop out, start all over again, wait another cycle, assuming I got in, take the MCAT. And by the time I started earning a decent living, say I did PMR and got out of residency, it would take me 20 plus years to catch up financially to where I was otherwise. And so that's the reason why I stayed in and didn't drop out. And then my first job was for a company called Erosti in Texas, and they would basically place us into family practices right away. So I basically worked with a family doctor immediately out of chiro school. I didn't work with chiropractors. I was getting medical referrals right off the bat. it literally in a medical office. And that's basically the only place that I worked before I moved to New Mexico. And even from there, we were primarily a soft tissue focused, almost a manual therapy focused physiotherapy office. To this day, I only work with naturopaths and PTs and not really with chiropractors, even though, of course, I adjust. But I do it in a much more medical approach, a much more orthopedic. We're not treating for wellness. We're not cracking backs for wellness. We're treating somebody's pain. We're referring them out if they need to. We're referring to people who do nutrition work if they need to. We kind of do hedgehog principle. We treat subacute pain really well. We teach patients how to take care of themselves. And other than that, we refer to other people. And one thing, I do a lot of fascial distortion model. It can be pretty hard on the body. I've been doing it for 15 years. It's very deep soft tissue work. And my body's good now, but will it be good in 15 more years? I'm not sure. And I think that, having medicine and the option of being able to do regenerative medicine as a fallback plan feels like a good idea, just in case my hands can't do this anymore. Because I don't want to have to, if my hands, stop working, to fall back and just be an adjustment only chiropractor. That's great for those that do it. I think they're really skilled and there's a market for it, but that's not what I like to do as a person. Like, I've never seen more than 12 or 15 patients a day. I'm not in that 110 people a day model. I've always been a little bit, which is funny as a YouTube chiropractor, is like chiropractors.
I gotta run. I'm sorry, I gotta run. But it's great to talk to you. Thanks for inviting me online, and thanks for sharing all the information. I gotta. It's my last night before I run back to the island, so I gotta.
You better spend some time with the wife.
Exactly. I'll talk to you later. Thanks.
All right, see you, Doc. Take care, man.
Bye.
Yeah, so Doc, we go to the same school. We're both chiropractors, and we go to St. James School of Medicine. So you guys are interested, you can check it out, sjsm.org. One of the cool things about St. James is they accept most of your prereqs that you've already taken, even if they're a little older. And as of now, they don't have an MCAT requirement, so you can enter more quickly. I will say this: if you're really scoring poorly on the MCAT, it may not be for you, because the MCAT is a predictor of how well you'll do on these standardized exams. But if you're somebody that's an older or second career or whatever, and you don't want to go back to community college and take a bunch of basic sciences and have to prep for the MCAT, but you think that you can do the curriculum, it might be for you. For example, physical therapists, chiropractors, people like that are looking to pick up a second doctorate. I think the school does a really good job of that. Like I said, Doc Rosen is an MD5. He's been doing really well. I know 2 other chiropractors that went through the program. And in my current class, we have a nurse practitioner, a physician assistant, a pharmacist, a massage therapist, a pathology assistant. So St. James is a really good school for people that have been in other healthcare fields that have experience but are wanting to get the MD degree and don't want to sit out 2 or 3 years taking prereqs all over again, or having to prep for the MCAT. The school does well. They had a 90% match rate this cycle. The school primarily is definitely getting primary care doctors, so family practice, internal medicine, pediatrics, pathology. They do have some neurology. They've matched some general surgery as well. So the school is a good school, but if you're wanting to be an orthopedic surgeon or a neurosurgeon or something, probably not the best school to go for to you. But if you want to get into family practice, internal medicine, or any of the things that come after internal medicine. So once you're an IM, you can do cardiology, gastrointestinal, GI, pulmonology, stuff like that as well. And the clinicals are done in the U.S. They're done in McAllen, Chicago, West Virginia. So you can get licensed in all 50 states. They do match in pretty much every single state. So it's been a really cool experience for both of us. And a lot of people didn't think we could do it, but Doc is doing really well. I'm doing pretty well myself. I've been Dean's List every semester. Definitely worth checking out. Culture Wellness, what's going on, Doc? We still need to make a rap song, I think. At St. James, the other cool thing is they have a ton of scholarships. So if you're a previous healthcare profession, they have scholarship money for that. So I get scholarship money for that. I have over a 3.6 GPA. You get scholarship money for that. I didn't take the MCAT and get it scored, but if you have a 5.12, I think, or a 5.10 maybe, they have a full ride scholarship for that. So you don't have any medical debt for med school. So if you were able to score a pretty solid score there, given what's happening with this administration of the PSLF loans, the cheaper you can get through med school, the better. And even if you don't get the full ride scholarship, I think the total tuition is like 9,000 per semester, so 27,000 a year, where most U.S. med school students are paying 50 to 65,000 a year. Now, I will say this, of course, if you can get into a good U.S. med school, it definitely sets you up for more competitive residencies. But if you're somebody that's gone through a couple cycles and you're wasting years at a time, or you're somebody that's been in another healthcare profession, I definitely think St. James is a good school. We also had a physical therapist in my other class, and I know they just had a PT graduate, and he matched into family medicine. So he's kind of combining the two things. He's doing family practice and incorporating some of that stuff with his PT work. So it's a good base to have. Like, it definitely has helped me. Like, getting an A in microbiology and chiro school definitely helped me get an A in medical school, obviously. The medical school is definitely tougher, but like I said, it's a good base to have. So if you guys are interested, you can check out the scholarships they have, sjsm.org. You go hang out on an island, not hang out, you got to study the whole time. But you get some culture, obviously. You get to meet people in different cultures. You get to drive on the left-hand side of the road. Definitely a cool experience. You get bit by all kinds of different mosquitoes. You get to try a bunch of different fruit, but the beaches are amazing. They're just absolutely fantastic. Full Metal Jess, I appreciate you watching the videos. So yeah, it's been a really cool experience so far. So I got one more semester to go for basic sciences. We'll take the NBME exam, and then assuming we pass that in STEP, then we'll go back to clinicals in the US. And we'll see where that takes us from there. Then I got to start getting ready for audition rotations and trying to match into residency, because weirdly, it's the only profession that your degree doesn't allow you to practice. If you're a chiropractor, optometrist, podiatrist, physical therapist, whatever, you finish your schooling, you pass your exams, you can practice. In medicine, it's the only one that you can't. You have to do residency to be able to practice, at least 1 year. For IMGs, it's usually 2 years. And even then, you still have to finish residency to where you can get into insurance networks and things of that nature. So it's a long road, but it's definitely one that's been exciting for me so far. I like the mental challenge, and I like proving the naysayers wrong. So hopefully by the time I get out of this, I'll have my 3rd doctorate, my 7th overall college degree, my 4th graduate degree, and we'll be looking at doing some stem cells and some PRP and things of that nature as well. So I hope you guys check in. Like I said, go follow Dr. Joel. He's over there as DC2MD is his Instagram, or his TikTok handle. He gives a lot of updates on what the process is like, does motivation and things like that. You can also check out SJSM, St. James School of Medicine, here on TikTok. And you can go to their website, sjsm.org, and check them out. Look at the scholarship, see if it might be a right fit for you. And then, stay tuning in. I'll keep posting some of my study tips, things that are working for me, things that aren't. Like I said, it's a little weird at my age, trying to figure out this technology, but things are going pretty well. And last but not least, shout out to my beautiful wife for supporting me and helping me out. Like, I couldn't do any of this stuff without her. She's the best. So cool. We'll catch you guys on the next one. Thanks for tuning in. I'll try to get on live a little bit more frequently on here, and make sure to go follow Dr. Joel.